Causative organism: Varicella zoster virus. Symptoms: mild to moderate discomfort, redness, photophobia, watering, blurred vision, reduced visual acuity. Dendritic lesions that are smaller and finer than herpes simplex dendrites, and have tapered ends without terminal bulbs. The lesions stain better with rose bengal than with fluorescein. Conjunctivitis, follicular or papillary. Episcleritis, scleritis, anterior uveitis, posterior uveitis. Workup: vesicular fluid can be sent for polymerase chain reaction, PCR, or immunomicroscopy. PCR of plasma for varicella zoster virus DNA. IgM antibodies to varicella zoster virus. Treatment: oral antivirals. Acyclovir 800 mg 5 times daily for 7 to 10 days. Valacyclovir 1 gram 3 times daily. Famciclovir 250 to 500 mg 3 times daily. Systemic antivirals. Acyclovir 5 to 10 mg per kilogram 3 times daily. Systemic steroids. Prednisolone 60 mg daily for 4 days, then 40 mg for 4 days, then 20 mg for 4 days. Avoid an immunodeficiency. Thank you.